Perfect. So we've got your slides full screen, John. That's absolutely great. Are we going to be joined by Bob, or is he coming in afterwards?
No, Bob unfortunately wasn't able to make it, so we'll be doing the video of the Q&A session that we were originally planning to do together. So if I can let you know when the right time is for you to play that.
Of course, no worries, John. We'll get that lined up, and yeah, 20 minutes. We'll do some Q&A as well. Cheers, bud.
Fantastic. Okay, good morning, everybody. Thank you for joining this presentation. My name is Jon Sugden, and I'm the head of Unified Comms and Collaboration at Prodec Networks. I'm going to start the presentation today just by giving a brief overview of Prodec Networks for those that haven't heard of us before, the solutions that we're able to provide, and some of the services that we've been providing the NHS, especially over the last 18 months to help overcome the challenges of COVID. This will lead on to the contribution from Bob Beckwith, who we just mentioned, who's the infrastructure manager at Newcastle NHS. He was hoping to join us today to do this live, but unfortunately due to other commitments wasn't able to make it. So we've pre-recorded a video of a Q&A session that we'd planned to deliver together. Newcastle NHS have worked with Prodec for around 4 years, predominantly delivering video and communication solutions across the trust, and have been an excellent example of how migrating services to the cloud has provided the scale and the flexibility required to meet the changing needs of the trust. Whilst on the theme of video collaboration, I'll then finish with a brief overview of a new remote patient consultation platform which Prodec is able to provide, which we think is a new and exciting application of video within the NHS. So a brief introduction to Prodec, and I will make this very brief, but we are one of the UK's leading providers of technology. We have been established for around 20 years. We started life as a network brokerage, predominantly focusing on Cisco, and the network still remains very much at the heart of everything that we do, albeit the solutions that we provide has expanded quite significantly over the last 20 years. We employ around 200 people, and the main thing to mention here is actually a large part of that sit within our professional service and support capability. So we deliver quite potentially large, complex projects, and the professional services required for most of those sits in-house. It's very rare that we need to outsource any of that capability externally. So we're in the privileged position that most of the projects that we're involved in, we're able to deliver entirely with our own in-house capability. We're headquartered in Twyford in Berkshire. And we have a northern office in County Durham, so we're able to cover the whole of the UK. And we're partnered with some of the world's leading technology manufacturers. So I've mentioned Cisco already. We are also partnered from a security point of view with the likes of Fortinet, Palo Alto, and from a UC&C perspective with Microsoft, Avaya, Mitel, and 8x8. So across all the various solutions that we offer, we aim to be partnered and provide world-class technology solutions. We are always aim to deliver the highest standards, and we are audited externally, ISO probably being the main one to mention, and we have the much coveted 27001 accreditation, which recognises the high level of security that we're able to provide across the various technology platforms that we offer. And we're obviously not just about providing and selling solutions. We are here to be a valued partner to our customers, and we obviously, as a result, support all of the solutions that we subsequently provide. So, what are we able to do? Well, the challenges of the modern day working are rarely met with a single technology. And Prodec is able to bring together numerous complementary technologies together to help meet the needs of our customers, underpinned by our understanding of the network. Whether applications are delivered from the cloud or on premise, the network continues to play a key role in the successful delivery of most of the technology that we provide. I don't have time to go through all of these various solutions area, but just to pick out a few. AV and collaboration, one close to my own heart. So Bob Beckwith is going to talk in a little bit more detail about this, but this area has seen enormous change over the last few years. The migration from largely on-premise solutions such as Polycom and Tamberg to cloud-based video conferencing that most importantly is designed for the desktop, and more recently, Microsoft Teams. Prodec is a Microsoft Gold partner, and we can support both the implementation of Teams as well as implementing room-based Teams video systems. UC&C has also seen a lot of change, again with cloud becoming a preferred direction for many organisations to provide the flexibility in delivering telephony to its staff, whether working in the hospital or obviously at home. Prodec is an Avaya, Mitel and 8x8 partner, and we were recently awarded the contract to deliver a new telephony system to 13,000 users within a leading NHS trust. Security and connectivity will always be an important consideration, and we have recently launched our own security practice to help advise our customers on delivering applications securely, both in the office, but also more crucially these days when working from home. So looking more specifically towards the NHS, so I've just put a slide here. We provide, as I've mentioned, a wide range of complementary technology. However, I've put some edited highlights of some of the work that we've completed over the last 12 months, and a lot has obviously been particular to helping trusts with COVID. We work with, I think it's probably nearer 15 trusts now across the whole of the UK, as I mentioned earlier. So from Newcastle and Northumbria down to Norwich, Norfolk, Queen Elizabeth Hospital, East North Herts, Luton and Dunstable, and some trusts in London such as Homerton. So we have a large number of NHS trusts. During the COVID outbreak, we equipped over 50 MDT suites with video conferencing systems, and these actually were usually part of much wider trust deployments, which in total enabled around 20,000 NH staff to collaborate from their PC or mobile device, which, when we added it all up, contributed to about 90,000 minutes of collaborative VC meetings every day. We also did rapid deployment of nearly 200 seats of cloud telephony services, which was to help an NHS trust enable some staff working from home. So I'm now going to hand over to the video of Bob Beckwith from Newcastle NHS to talk about some of the projects that we've worked on together over the last 18 months.
Thank you very much, John. Just getting that loaded in now.
Okay.
Hi, I'm Bob Beckwith. I'm the Infrastructure Manager for Newcastle Hospitals. We've used video for a number of years. It came about from the Northern Cancer Networks. They had an initiative to put it across the region, and we ended up with a number of installations, predominantly at the Freeman Hospital. So we've progressed that use over time. There was a few challenges with the initial installation. They were all local installs. They had ISDN gateways in the rooms. Management was very labour intensive. Couldn't really do a lot more than point-to-point calls. But overall, it did what it needed to do. Very small number, handful, 5 or 6 systems across the whole organisation. And it did what it needed to do. And that was about it. So a few years before the pandemic hit and video collaboration skyrocketed, we identified the requirement to have video throughout the organisation. We're very large. We've got 2 main sites, got 14,000 employees. So it didn't take long before those requests were coming in to use video for more than the systems we had installed. we looked at a number of options to facilitate this requirement, and it was quite obvious that a cloud solution was the only way forward. These individual installations in rooms just were not sustainable. So we reached out. Prodec helped us, proof of concepts, introducing us to manufacturers, numerous demos, and we settled on a Starleaf system. We're early adopters of Starleaf, I think, in terms of the NHS, and it was a huge success. We rolled out a number of systems, MDTs were involved. People had the ability to purchase systems at relatively low cost and install them in their departments rather than having to book rooms out all the time and wait in a queue before space was available. And also we rolled out the client. So for the first time in the trust, we had desktop enabled video conferencing, video collaboration. And again, that was a huge success. A lot of people straight away saw the benefit of not having to travel across sites, the benefit of talking to colleagues outside the trust, and overall the feedback was very good. Pandemic hit. We were in the fortunate position to have a cloud-based solution installed and proven and widely adopted. What happened almost overnight was the demand went through the roof. So people instantly wanted the ability to communicate when they weren't on the site or face-to-face. Some of them have become very used to now, but at the time we weren't. And the cloud-based solution was ideal for that. We weren't prescriptive on what devices people needed to use. It would work on any device they could get their hands on. And at the time it was, any option was available to them. So personal devices, trust-owned devices, devices that would VPN back into the trust, devices that wouldn't. Whatever was available, that service could be installed and ran from it. And we had seen, I think I'd have to look at the stats to get the exact figures, but a 5-fold increase in the number of people using it for messaging and for video. There weren't just clinical staff. It was a huge bonus to have the tool available for administrative staff as well, just to keep in touch, team meetings, etc., share documents. But in terms of delivering our core service, a clinical service, the tool was used a lot in the ability to bring the specialists together, kind of an MDT, but more of a remote MDT. So in the past, where you would have had traditionally people in the room and a far end brought in, so 2 groups of people talking together over video, we moved from that to individuals joining in from individual devices to form a group. And the cloud technology really let business continue when the pandemic hit. Introduction of Office 365 and the licensing agreement between Microsoft and the NHS, that we as an NHS trust had the option to buy into that, which we did. So we purchased the Office 365 licenses and we became part of a shared tenant. With that came the ability to use Teams. So again, a cloud-based collaboration video IM platform. And that followed on very nicely into the adoption of our previous cloud-based solution, Starleaf, because our users, our staff, were already familiar with using video. The tool, in some respects, was irrespective. They had the cameras, they had the microphones, they had the headsets, they had the stigma of talking to a screen had gone. It became natural. So introducing Teams was relatively straightforward from a user adoption point of view, and also not a difficult task from an IT point of view either. So that big jump in usage of collaboration tools in Starleaf and the cloud service continued once we'd signed up to Teams. And as we all know now in the NHS, Teams is very popular. It's arguably the tool of choice when it comes to collaboration. And then all of a sudden, people could then IM others in the NHS. They could share documents and work collaboratively with others that were using the same tools. And Prodec helped us deliver the upgrades, so replacing installed equipment with Teams equipment throughout the trust. And the number of systems we have is continuing to grow to this date, with a slight shift, I would say, in the way people are using the technology. With the agile working and the home working, people became used to using their own device, even if it was to talk to colleagues that they had previously gone into a physical room to talk to. And it's quite ironic sometimes in the office, you'll see 3 people using Teams to talk to each other, sat next to each other on video. And I think that's just people have become so used to using the technology. One Saturday morning, I received a call from my director to say, "Can you meet me at a warehouse in Sunderland?" not the usual phone call you receive on a Saturday morning. So I turned up, and there was about 4 of my colleagues and my director stood in a very large empty warehouse. I'll be honest, I wasn't sure what was going on, but quite quickly it unfolded that this warehouse was required to be a hospital as soon as possible, in a number of months, weeks. So once we all got over the shock, we were all given our tasks. Myself, working in IT, was asked to deliver connectivity, telephony, video conferencing, PCs, printing, patient Wi-Fi. The list was quite long. So challenge accepted. Off I went to sit in a quiet corner to contemplate it. And one of the first calls I made was to Prodec. So I discussed with the account manager at the time what the requirements were. Once we both accepted the challenge, I guess, we got onto it. So there was no questions asked that it was a Saturday. We'll work the Sunday. You know, it never really came into the conversation the day of the week it was. We just got on and started to look at what was needed. We had a number of calls with the wider Prodec team who had never met the telephony side before, but good guys, had a chat with those. Quickly developed a technical solution for all the deliverables we asked for, and I would say within a week or less, maybe 4 working days, we were quite clear on what was needed, quite clear what Prodec could deliver, idea of costs and when they could deliver it. So that was fed very quickly back into the project, and then quite literally the troops arrived because the army helped us with this build. Prodec turned up, we delivered the services, we tested them, and in the end, I was personally quite proud of what we achieved. The building turned into a fully fledged hospital. It had everything from wards to the admin areas to mortuaries, cafeterias, receptions, change areas. Everything you'd expect to see in a hospital that would maybe take 3-4 years to build. In terms of the technology, we made the conscious decision to keep it as standard as possible for obvious reasons. So video conferencing was installed. We expanded our telephony system into the building and incorporated a deck system so the staff could use it on the ward areas. And it's been recognised nationally what a good job was done. So it's something I would certainly remember as part of my career, and I would thank Prodec for their help with it. The trust relationship with Prodec is 3 or 4 years old now, and I think we're now at the point where that trust has been built up between us. Certainly they are my go-to person when something lands on my desk that needs to be delivered, hopefully not as quickly as the Nightingales, but in normal timescales. And one of the benefits, or there's a number of benefits, but I'd say one of the things that stands out with Prodec is their ability and their willingness to let us test things, proof of concepts. Some things work, some things don't. Some things are very expensive to buy. Prodec can provide those for us. We can put them in real life rooms and real life situations and give them a test. And I think Prodec's relationship with the industry has also helped with that, because quite often IT guys will suggest a certain way and Prodec will try and steer us down another way, because we're not all experts. And overall, the end result is something that works because we've tested it, which is great, but also we're not wasting time on looking at technologies that really that aren't fit for purpose, that we may have done without having someone like Prodec to go to first.
Okay, great. Hopefully that came through okay for everybody. I'm conscious that we are running over slightly, so I'm just going to run through the last two slides very quickly, and just wanted to introduce Conflab Health, which is a remote patient consultation solution, which enables clinicians to remotely consult with and triage their patients. It is a flexible solutions. Obviously, the needs of individual clinicians varies enormously, and as a result, it is a solution that can be tailored to meet these individual needs. It has been built from the ground up to deliver remote patient care, so in consultation with numerous clinicians, to ensure that it includes all the key features such as waiting rooms, medical note taking, document management, and screen sharing. It is a cloud-based system, so it can be deployed very quickly and simply, and this can be done obviously to a unique instance for your organisation. Remote video consultation is rarely an out-of-the-box solution and will need to be tailored for each particular application. Conflab Health offers a totally customizable platform, as I mentioned, but also integration with existing patient record systems such as Cerner. As a result, we have found, and this is a relatively new area for most trusts, that an extended proof of concept has been invaluable to allow trusts to tailor the solution within their existing workflows and patient record systems. This also assists with a smooth transition to a go live, as the system can almost be soft launched during a proof of concept. We're always keen to facilitate trials, and for trusts already using Attend Anywhere, Conflab Health has offered a free implementation and use up until the end of that contract period if it's required. So a brief introduction on that. There is more information on that on our website. And I think that then just leads us on to the questions, if there are any.
Hi, John, can you hear me okay?
I can.
Perfect, thank you very much. Great presentation. So we've been asked quite a lot, and obviously it's been great to actually share. Are we okay to share the Q&A with John after the event? Would that be possible? John, can you hear me?
Sorry, what? I can, yes, sorry.
Just saying, are we okay to share the Q&A with Bob post-conference with Beth, you see?
Yes, of course.
Absolutely brilliant. So just a quick question before we have to move on. Other than Newcastle, how many other NHS clients do you have at the moment, John?
Like I said in the presentation, we're working with around 15 NHS trusts at the moment.
About 15, do you say?
Yes.
Absolutely perfect. And you know what? While we're here, we'll just get one quick question in. So, is Conflab interoperability with primary care clinical systems like EMIS and ROI?
Yes, it is. Although what we're recommending is that we engage with the manufacturer of Conflab, who's called Flabber, to work with trusts on those integrations. So it is a relatively new solution. It's remote video health consultation is quite a new marketplace. So a lot of these integrations are being done with trusts as part of proof of concept. So what I would recommend is get in touch with us, and we can arrange that kind of introduction to Flabber and work through some of those specific integrations.
Absolutely brilliant. Just had a comment from Angela as well, just saying impressive story, great example of rational choosing the providing contrary to talks about sleazing in pandemics. So yeah, just a bit of comment. So thank you, Jon. Absolutely brilliant presentation. We'll get the video and slide share post conference, and yeah, just cheers again for getting involved.
Thank you very much indeed. Enjoy the rest of the day.